Hey guys, what's going on? Hope you're having a great Easter Friday, I guess it is today, Good Friday. Really excited to share with you a really cool resource that I just finished putting together yesterday. It's called the Virtual Practice Blueprint. And the reason I created this training is because we have been having a lot of conversations with practitioners, practice owners who are in a bit of a predicament and they're looking to get out of that predicament. And that predicament, as you're probably well aware, is that the doors are probably closed for most of them. With that means there's more cancellations, so patients are basically canceling appointments. And what that means is the expenses are still there, but income has dropped significantly. Now, unless you have some magical powers to get out of your lease if you have a brick and mortar practice, right? The reality is that you're still paying the, certain expenses. You might still have staff on board, you're paying salary, etc. Yet income has taken a bit of a hit. So that's a big problem for a lot of practice owners, and we're doing our very, very best to help them solve that. I'm very fortunate that we've had a lot of new clients come into our program in the past 2 weeks, which has been tremendous, and we're hitting the ground running with them. It's like right away to help them get results. So I'm very, very grateful about that, and just super honored to be able to serve some amazing practitioners. So anyways, the Virtual Practice Blueprint is really about showing you the three-step practice. It's 3 practice-saving steps to reducing cancellations, taking your practice online, and then getting new patients booking in with you who've never heard of you before. Okay, so there's 3 steps, 3 things that we're going to cover in this training. I've actually included the link somewhere around this video. And because you're part of our tribe, I've just given you full scrollable access, so you can just kind of go back and forth through the video and watch it. It's about 1 hour and 30 minutes. But anyways, you can scroll, pause it, rewind, take some notes, because it's very tactical. So I'm going to show you exactly some very specific examples of how you can reduce patient cancellations. Number 2, I'm going to show you exactly, like with real examples of how you can work with patients and clients online, especially if you're a hands-on practitioner, like a physical therapist, chiropractor, and you're thinking, there's no way I could do this. Believe me, there is. And I'm going to share actually an interesting idea I had for a business model in a second, a new business that has nothing to do with health. I think it's actually pretty clever though. And it's going to tie into this whole idea. But we had a training yesterday for our Luminaries Mastermind, and I had my good friend Simon Bowen from Perth, Australia, who is the models guy. He draws models and simplifies complexity. He's brilliant. So he did an 1 hour and 20-minute training for our group. It was phenomenal. And one of the things he was saying was that one of his clients is a physiotherapist or physical therapist in Australia. And the challenge was the reality, like his practice was closed, the clinic was closed, couldn't see any patients, and the challenge was that he still thought of himself as a physiotherapist, right? And so with the work he was doing with Simon got him to reframe, you're more than a physical therapist, and it's not about you and your identity, it's about looking at what are the problems, what are the pain points right now in the marketplace, and trying to figure out, can I solve those? So after several conversations, he recognized that the biggest challenge for people is that they're at home, there is a loss of productivity which is hurting them in their work, and their posture is just worse than ever before because they're hunched over on the couch or their computer and so forth. And so instead of calling himself a physical therapist and kind of pigeon-holing himself into that, he kind of renamed what he does as a work from home specialist. I think it was something like that. Anyways, so he was able to somehow pitch this idea. So the physical therapist, he was able to pitch this idea to the largest grocer in Australia, thousands of employees, and they actually bought his whole idea. And so now he is training virtually in a very leveraged fashion thousands of their employees. Can you believe that? It's amazing, right? And so this is an example of what it means to be innovative and think about, how can I solve a problem right now, even though it's a little bit different than what I'm used to, okay? And you have to be okay with being able to adapt, because if you don't adapt, one of the things I'll share with you in the training is there's 3 stages that are required to go through, right? And they're toward the end of the training. But you have to understand what those 3 stages are, because if you stay at stage 1, your business is you're gonna go out of business, okay? And I'll show you exactly why that's the truth, and I'll show you how to move to stage 3 so you can really survive and thrive in this current time. So the link is around here. Check it out. It's really, really good. I think so. It's very tactical, so it'll give you some very specific ideas, and then we'll walk you through how to build out a system to get patients coming into your world, even if they've never heard of you before, because quite honestly, most of us are unknown to most people. Let's just be honest, right? We're not Dr. Oz, we're not the president, so most people don't know us, and I'm going to show you how to, without an online platform, without a huge following, even if you've got a website, even if you don't have a website, even if you have no following on social media, none of that stuff matters, guys. None of that stuff matters. And I'll show you exactly what to do instead and why now is the best time to do that, because more people are watching stuff online, they're on their computers, they're on social media, they're consuming more content, and they still have their problems, right? Their problems didn't just disappear overnight because of COVID. In fact, their problems may have got worse. So they still need your help, and I'll show you exactly how to tap into that in a way that serves them and saves your business. So check it out. The link is around here. I'll also put it in the comments. And then along these lines, I had an idea last night I think it was while I was sleeping or when I got up, and I was thinking to myself, you know, it'd be an amazing business right now. And maybe it doesn't make sense, obviously, if you have your own health business, but I'm just thinking for like the general public, okay? Like this is literally the general public, whether you're 70 years old or 25, and let's say you just got laid off or you can't work. Here's what I think is an amazing opportunity, is creating a remote tutoring service. And the reason I say that is because I have 4 kids at home and my wife is looking after them for the most part of the day while I'm doing this stuff. And it takes up a lot of her time, right? And like if you're a parent, you love being with your kids, but there are moments in time where you need a bit of a break. And when your kids are at home with you all the time, you don't have a break. But if you were a remote tutor that somehow got a message in front of parents or families or whatever and said, hey, listen, like I know you're super busy, you got the kids at home, give me 1 or maybe 2 hours with them every day over the internet, and I will teach them what they need to know with respect to anything. But here's the cool thing, the cool part. You don't have to be a teacher, or these people don't have to be teachers. They just have to know stuff, right? So if you're somewhat good in math, if you're somewhat good in English, you could teach those fundamental skills, those subjects to anyone, right? So let's say that you're a hairdresser and your salon is closed. Maybe it's an option. Maybe you work for a factory and the factory got closed, shut down. Hey, maybe you could teach some stuff online. Again, this is a complete divergent path from obviously running a health business, but I share that with you because get your mind thinking of problems and how you can fix those solutions. I'm not saying set up a whole new business teaching people how to do math over the internet, but like there's ample opportunities. And the sad part is that most people right now, they're going to be sitting at home twiddling their thumbs, waiting for the government to take care of them or their unions to take care of them because they can't teach in a physical school. Okay? And it's the same reason why these teachers, I think teaching is one of the most valuable jobs on the planet, right? If you think of the word doctor, it means teacher, right? I've always considered myself a teacher and I could care less about the school system. And you have a lot of these teachers, and sadly I went to school with a lot of people who went into teaching, and their big motivation was so that they could have the summers off. I'm like, that's disgusting. You should be fired for even thinking that. You should want to teach because you actually want to help people, not because you get like summers off, right? It's ridiculous, or a good pension. So anyways, I think it's like opportunities like this. There are people teaching English on YouTube that have 3 million subscribers. It's amazing, right? There's opportunities for this stuff left, right, and center. And my goal with you guys, especially if you've got a brick and mortar, is to help you think outside the box. Because if you don't, it's not gonna get better, guys. I was just reading an article in the New York Times this morning. They're saying this could last for 2 to 3 years. Like the economic impact of this. Like we're in a recession, okay? And this is not getting better anytime soon. So if you're sitting around waiting for this to fly over, you're going to be gone, right? And I don't want that to happen to you, okay? So you have to be okay breaking the mold. You have to be okay doing something different than what you've done, because what you've done up until now is no longer even relevant. You can't physically have people in your practice. And if you are hoping that the doors will open in a couple of weeks, maybe they will, but I don't think, probably they're saying until June is going to be like full on lockdown. So that's several months away. And then think about this, even when the doors do open, do you think people are just going to flock back into social interaction? No, no, no. Like this virus, it's going to go away and then it's going to come back in some way, shape, or form over the next couple of years. And the apprehension people are going to have to interacting socially in the same way that they have been for years previous is very different. And use this opportunity to just be smart about it, okay? Like I'm not saying you have to be virtual forever for the rest of your life, but even if your brick and mortar goes back up and running in a couple months, wouldn't it be amazing to give your patients the opportunity to say, hey, you can come in or we can work with you virtually, whichever is best for you. And this is what's happening right now is the great equalizer. This is going to equalize and wipe out the whatever happened before. It's clean slate, okay? And so right now it's those who are like, okay, cool, let's hit the ground running and let's do this as fast as possible. I was speaking with our clients yesterday on our Q&A call, and Damien, one of our clients, amazing, like he does some amazing stuff with hypnotherapy and behavioral change. And we're working on some stuff, like he helps smokers and people with like coping mechanisms that are not that healthy. And he was saying like he's had some incredible results with people with anxiety, right, and stress. I'm like, dude, this is the time. Like people, like never before have they been more stressed out, perhaps. And I told him, I'm like, dude, you have to have like a maniacal need to get this out there as fast as possible. I said, you need to get off this call right now. You need to get whatever you need to get set up right now so that you can deploy this tomorrow. Because right now, this is an opportunity to serve people and really take advantage of this opportunity. I'm not saying take advantage of people. I'm saying take advantage of this opportunity where you can be first to market, fastest to market, the first one to innovate and introduce solutions to the people you want to serve in such a way that they're like, man, this makes sense. Let's do it. Okay? So anyways, long-winded little video, but hopefully this makes sense. And check out the virtual practice blueprint training that we've just released. I think you'll find it really helpful. And guys, have an amazing Easter Friday. Just keep on tracking, baby. Keep on tracking. All right? Ciao.